So with that, I'm going to stop and open us up for questions.
Can you tell us the age of the child who has the multi-symptom syndrome?
School-aged child.
Can you tell us the zip code of that patient?
I'm going to stop there in terms of the amount of information that we share.
And Doctor, the Governor gave us a lot of ages of children who are in need of immunizations. Can you give us what's the age of children who are in need of immunization? How many children you anticipate are going to need these shots?
Well, as the governor shared, we have about 50% or so of our pediatric population to be able to catch up with. We definitely want to emphasize those ages, particularly 4 years of age prior to entering school, and the 11 and 16 years of age, because as children get older, they feel it's less of a necessity, so we want to strongly encourage that, and continue certainly those that are less than 2 years of age.
Can you estimate how many kids we're talking about?
I can get that number to you.
Doctor, will there be any effort to enforce immunization as a condition of enrollment in public schools?
We will continue the current practice that we have that actually has led to why we've been so successful with immunization. We'll work closely with schools and school nurses to enter school. Getting your vaccines up to date is an important component. It's a tool that has been valuable in helping to ensure that all children from every zip code receive the vaccines they need.
Governor, what is your reaction to, I know this came up in Narragansett a while ago, but the Burrillville Town Council the other night passing a resolution basically rebuffing your executive order, saying it infringes on constitutional rights. And I know 2 days ago you said this isn't about politics, it's about science. What's your thoughts?
I think that's still my reaction. I don't have much of a reaction. The law is the law. As the chief of police said there, it's his job and his officers to enforce the law, and I expect it to be followed throughout the state. We feel very confident that I'm on firm footing in a state of emergency to do what's necessary to keep people safe. I'll also say this, you know, we haven't had a heavy-handed enforcement approach. This came up in Narragansett, it came up, I think maybe in, I can't remember, another town. And, you know, it's the job of police officers to de-escalate, and they've been doing an excellent job of that. So I think that we ought to stay out of politics, stay focused on keeping people healthy, and stay focused on following the law.
With what's happening in other states, I mean, do you feel like your approach has been proven right? And I know I've asked you about critics and saying you've overstepped. Do you feel like this basically says to them, I'm right and you're wrong?
Well, I wouldn't say it that way, but I would say what we're doing is working. So you can't really argue with it. We've tested the equivalent of 22% of our population, and we have a test positive rate of less than 2%. We were the first state in our region to reopen our economy, and we still haven't seen an outbreak. We never closed down manufacturing, and we haven't had an outbreak. So, yes, I mean, I would say this formula that Rhode Island has, aggressive testing, aggressive approach, mask wearing, is working. And so I don't have a very open ear to folks who say they just don't agree. Because unless you can show me facts which say this is the wrong approach because it's not working, that I'll listen to. But we don't feel like following the law is not very interesting.
Well, Governor, to talk about phase 3, so your executive order on phase 2 ends Monday.
Correct.
Monday is announced today. Is
Correct.
Tuesday still on the table?
Yes.
So you
Yes.
could say Monday, it's Tuesday?
Yes, thank you, Ted. And one thing I neglected to say, I'm also going to be addressing on Monday travel restrictions in addition to phase 3 announcements.
Meaning involving these states.
Exactly, meaning involving these states. We talked about that the other day. We are likely to do something around that. In fact, I want to do something around travel restrictions for people traveling from other states to Rhode Island. It's easier said than done to figure out all the what-ifs and how you execute it on the ground. So we're going to take the weekend. I would say, yes, Monday, it's likely possible that I will come up here and say phase 2 begins Tuesday. Excuse me, phase 3. Phase 3 begins Tuesday. We may have some modifications to what I've previously rolled out around large gatherings in light of what we're seeing in other states. And I'm also going to address travel restrictions.
You mentioned on CNBC the other night potentially to have mandatory testing. Is that still something you're considering?
Yes, yeah, that's exactly what we're considering. And what we're trying to figure out, I'll just be very honest, what we're thinking about is how do you do it? Is it enough to make somebody a test, that they had a test in their home state within 72 hours before they came here? Or do we have to test them once they're here? How do you find these people? So it's a good policy. Actually, you know, people come by boat. A lot of folks have their boats up here coming from Florida. People have already rented homes. They might already be here for their summer vacation. So it's a good policy. It's hard to figure out the details. Luckily, we have excess capacity in testing, so we want to try to use testing. So we need to work this weekend. The bottom line is, look, I'll be very, very honest. Things are changing. I didn't, you know, you have the governor of Texas telling people to stay at home now. The hospital's filled in Arizona. North Carolina's having problems. South Carolina has a lot of hot spots. So I just have to pause, study, reassess, and we'll be back Monday. And hopefully on Monday we'll say phase 3 starts Tuesday.
You're in a different place than you were a week or so ago based on what we're seeing.
Yeah, at least, yeah. I would say, I don't know if I'm in a different place, but I'm in a, it's my job. It's my job to pause, reflect, dig into the facts, and make sure we're ready. And so that's what I'm doing.
Governor, okay,
you need to call on people.
Governor, we've discussed the Christopher Columbus statue, and on Tuesday night, there were 100 Providence police, state police there because people showed up that had ropes and hammers, and they were going to tear it down. Wednesday, it had a 24-hour police presence. Mayor Elorza made the decision, not you, but yesterday it was brought down. Can we agree the statue was removed for threats of violence? Is this the new Rhode Island where mob rule makes decisions on how things are done?
We can't let that be the new Rhode Island. Listen, I think the mayor did the right thing. I do. I think that it was his decision, as you say.
But do we agree that's why? It was because of violence. People were going to rip it down.
I believe so. You should ask him. You should ask him. But I believe the calculation was, at this moment in time, that's attracting violence and could be an issue, so remove it. And I think, in light of the circumstances, that was smart. But look, I think we're in a moment right now of extreme anxiety, uncertainty, economic unrest, and I hope, no, that's not the new Rhode Island. The new Rhode Island, when we come out of this, is going to be better and stronger and safer and healthier than the old Rhode Island. But in this moment, right now, we are struggling. And so I think the mayor decided if he could remove that to alleviate tension of the threat of violence, it was a good thing to do.
Do we know what the demands are for next week? Are they going to climb the top of the State House and rip the Independent Man down?
We're going to do what we need to keep peace. Peace.
Follow up on Ted's line of questioning. Do you anticipate reintroducing checkpoints on the highways to check people as they come into the state?
That is not what we're considering at the moment. We are considering working with the airlines in the airport, people coming from faraway places to our airport, maybe the train station, possibly partnering with realtors, you know, for people who have rental properties, make it part of a contract, testing, working with companies. You know, business travel is going to start to pick up at some point in time, not tomorrow, but maybe in 2 months. So, you know, working with big companies that do a lot of travel. So that's how we're thinking about it.
Governor, how much of your...
Hi, Governor Raimondo. In the recently released 2020 report of the Advisory Council for Locally Administered Pension Plans, and I want to note this was pre-COVID, 21 of the plans were less than 60% funded, considered to be in critical status. 6 plans actually reduced funded status since 2012. As the principal architect of pension reform, are you or is the state of Rhode Island involved in any substantial conversation with municipalities should further market disruption threaten their viability?
So we are available to support and assist, and we have a whole team of people who actually report to Brett, who do municipal finance. But every one of these cities and towns has their own separate systems, which they've negotiated on their own, which are set out in a contract. So I have zero appetite to pass a state law to break a local contract that was bargained for by municipal leaders and their local unions. Having said that, what you share, that's alarming. And I would strongly encourage mayors, town managers, et cetera, to figure out how to fix that. Because if you have a system that is, you know, as you say, whatever, 20% funded, you're at serious risk of someone not getting their pension down the road. And so I would say that someone has to say the buck stops here, we're going to solve this, and the municipal leaders have to do that.
Thank you.
Governor, how much of your thought process going into phase 3 is based on what's happening elsewhere? Because as you keep saying, Rhode Island is in good shape, and Rhode Islanders hear this and are like, we're following the rules, we're doing well. How much of that is a factor? And I know it's only a couple of days until Monday, but the people who are seeing this and now are trying to make 4th of July plans, either have family coming up or something like that, what do you say to those people?
I say just wait till Monday. Look, my original executive order expired Monday anyway. We've already laid out what phase 3 is going to look like. So I'm just saying hang on for the weekend, and we'll come out on Monday and make an announcement. That's a very fair point, to say, listen, Governor, we're not Texas, we're not Arizona, we're doing fine. Having said that, something's going on in these states, and I just feel it's the responsible thing to do to dig a little bit more into it, have some more conversations, and frankly, just to see a few more cards of our own data. You know, like, we started, here's the thing, how we think about it. Phase 2 started on a particular day. People didn't immediately go out the day after phase 2 started. Like I said, okay, restaurants are open, you can go get your hair cut on a particular day. We noticed it took about at least a week before people were really going out to dinner, getting their hair cut, getting their nails done, going back to work. So, you know, we'd like to see today, tomorrow, Sunday, what does our rate of spread look like, make sure there's nothing. A few more days matters. And it might be hard to understand a few more days matters, but it does. And so even though we started phase 2 on a particular day, it didn't really get started for another week. So it's just a tiny bit of extra caution to make sure we're doing everything we can to keep people safe.
Governor, I don't want to put you on the spot for a counterfactual assumption, but your strategy overall over the long term, as I understand it, is to replace physical restrictions, staying at home and that kind of thing, closing down retail businesses, with increased testing, increased isolation when people test positive, rapid response, and contact tracing. Would you say that those strategies are able to completely replace the shutdowns, the economic effects that we've had, or nearly so, and that if we'd had that kind of aggressive testing, isolation, contact tracing months earlier, we may not have even needed the economic shutdowns?
Okay, so I would say, here's what I would say. It is absolutely true. If we had had, as a country, better testing, better PPE, you know, better access to the supplies we needed, better contact tracing immediately, we would not, in my opinion, have had to do the radical and immediate lockdowns that we did. So if the federal government in January started to prepare properly and made massive investments in testing equipment, testing supplies, PPE, helping governors, logistics, it is quite possible that by the time March and April rolled around, we would have had other arrows in our quiver other than a lockdown of our economy. to answer your other thing where I don't fully agree, listen, if we told everyone to stay in their house and not leave for a year, yeah, that would be effective as it relates to the virus. But that is a terrible idea, because then, for all the obvious reasons. So what we're doing here is a balancing. People need to work. Our economy needs to function. People need to have social interaction. People need to go to the doctor. I just told you I'm so worried about these children who aren't immunized. So I have found that in order to allow people to live their lives and do what they need to do, what you need to do is have this aggressive approach around testing, contact tracing, quarantining, isolation, et cetera. And to Brian's question, here's what I don't want to do. I don't want to say we're moving to phase 3 and then in a week or a half, 2 weeks, saying, we should have waited, pull back. I'd rather take a couple more days now and have a bit more confidence and go ahead and make the announcement Monday.
I just got a question from a viewer watching who asks, do you recommend Rhode Islanders who have soon planned to travel to Florida, one of the hotspot states, call it off? Are they at risk of a quarantine? I know it's tough, but are they at risk of a quarantine on return if you should have a new policy Monday?
Oh, I'm sorry. Are they?
Rhode Islander going to Florida for a family visit or something, but then coming back?
They are at risk of a quarantine or at least a test. So if they're comfortable with that approach, knowing that they have to be tested, then you can either wait till Monday or what I just said. I thought you were going to ask me, should they not travel, and that's a personal decision.
Bill and then Dan.
2 questions, unrelated, but I guess related in the sense they're both about Newport. There's a new hotel opening up in Newport today. What can businesses do right now in the private sector to kind of get ahead of, I know you're not announcing until next week what they can do, but is there anything that they can do right now that they can implement from a legal perspective? Can they turn away guests that may have booked that are coming from hot spots, or is there anything that they can do?
I wouldn't do anything right now. I wouldn't do anything right now. We're never going to say you have to leave. We might say you have to be tested. We might say, you know what I mean? I would say just do nothing and wait a couple days, and we'll have clear guidance, and whatever we do, we'll help you. We'll help you figure it out. So I think proceed for the next couple days.
Secondly, following up on John's question, there's a Columbus statue in Newport as well. I just spoke with Mayor Bova. She seems open to the idea of a council resolution to remove that statue. There hasn't been any violence or anything of that sort there, any mob rule. It just seems like the will of many people in Newport is to have that statue removed. Any thoughts on that?
Yeah. I'm smiling because I always go to the Columbus Day Festa in Newport, and it's a great event. That's her call. That's her call, right? If she feels that she can safely leave it up and the community wants to have it, then she should do that. If she decides, like Alorza decided, that for a temporary period of time it's a practical thing to do, then she should do that. I think these are, sometimes you just have to make practical decisions and not necessarily think about the statement. At the moment, she has to do what she thinks right to keep her people safe today, tomorrow, and this, in the weeks to come.
Governor, on the housing vouchers, what are you hearing from landlords for why they're not actually taking advantage of it? There aren't that many, or as many as you hope. That's number one. And then just the number two is, if the legislature doesn't pass the ban, are you going to do some, or the change, or are you going to do some sort of executive order?
I don't think I can. I would if I could. If I had that authority, I would. I've supported this legislation for years. I don't think it's a defensible position to discriminate on the basis of source of income. It just discriminates against poor people. What was the first question? Well, I don't have a good answer. I do not have, I don't know if you have a better answer. I don't have a good answer. We just, there's a stigma associated with the vouchers, and I think it's discriminatory. And that's why we're trying to provide an economic incentive to give folks a push to get them to think differently. Sometimes I think, I don't know. I don't have a good answer. It's the way it is. It's the way it's always been. And we're trying to give people an economic incentive to think differently and open their mind to a different approach, to rent to all comers who can pay. These aren't folks who can't afford to pay.
Last two questions from Brian and then John.
Governor, the diagnosis of a child with multi-system inflammatory syndrome, is that changing your view on anything with like youth sports, summer camps, schools, and how should parents react to that news and considering how to keep their kids safe?
Exactly what the doctor said. We shared it with you. It just happened. So I would say, first, you should feel relieved that we're being fully transparent. Secondly, as the doctor said, it wasn't a surprise. We're seeing this in other states. It's a single person. Parents should just do what they've been doing. Be careful for their kids. I can speak as a parent of teenagers. It's hard to get your kids to wear masks. So you have to be on them to do it. It's hard to get your kids to wash their hands. So just everything, be vigilant with your children. Keep them out of crowds. Keep them home if they're sick. Get them their well visits. Make them wash their hands and wear their masks. And if they're going to play sports, they have to follow the rules.
But it won't change anything in terms of...
No, it hasn't affected our thinking.
John.
Governor, when this started, I believe a lot of homeless people were placed in hotels. And I believe that Nilo Hotel is one of them in Warwick. We've seen a level of increased complaints from some of the neighbors. And the question is, how much longer are people going to be kept in these hotels? And how many people do you have in these hotels?
Yeah. I'm going to let Brett answer the details, and then I want to answer it too.
Yes, John, there's two pieces to the hoteling of Rhode Islanders experiencing homelessness. There's a group of folks who are quarantined for medical reasons. Either they're COVID positive or they've been exposed and therefore need to quarantine. That which is happening at the Wyndham, while we might change facilities, the providing of housing for homeless Rhode Islanders who are COVID positive, that will continue for some time. There was a second effort, including the Nilo, which was an effort to de-densify the shelters because we were concerned about the rate of spread in shelters in dense congregate settings. And that program is going to be wrapping up next week. There's over 100 Rhode Islanders housed in 2 facilities. And that's part of the strategy that the governor has been talking about and part of the impetus for the landlord challenge as well, because the solution is not future hotel stays, but rather permanent affordable housing to provide housing security for Rhode Islanders. And so we've been working closely with the homeless service providers such as Crossroads, who've been a key partner in this. We've tried to, solve the problem from both ends, which is we've provided additional rental assistance to help new Rhode Islanders stave off homelessness, but then we've also tried to address the supply side through the availability of additional units to get landlords to take vouchers from Rhode Islanders because we have vouchers available. We have a lack of available units. And so we are trying to be comprehensive in our approach. We're working with the providers, we're working with the home communities, but the hoteling for the sole purpose of de-densifying the shelters, that wraps up next week on June 30th.
Anything else?
Just briefly, Dr. Alexander-Scott, on the MISC questions. How is that? I assume that's not a test thing you check, right? It's the doctors observe and diagnose.
Correct.
Are there any suspected cases otherwise right now that they're monitoring, or do you think so far this is the only person who's presented with those symptoms?
This is our only confirmed case. We don't currently have other suspected cases being monitored.
Thank you, everyone.